Good evening, everybody. Oh no, not again. Is that what I hear you saying as we talk about COVID yet again? Well, COVID never went away. It just became possible to live with it. But is there a new dangerous variant in town that we need to worry about? I'm Barkha Dutt, you're with the Mojo Story. Our special focus today is on what's being called a standalone variant of interest by the World Health Organization. It's the JN.1 variant, and it seems to be rapidly rising in India. In the last 24 hours alone, there have been 600 cases. The cases overall have crossed 3,000, and these are, of course, just the recorded cases. The question still remains, is this a matter of concern? Most of us have stopped taking annual vaccines for COVID since, let's be honest, probably the end of 2021 or at least the beginning of 2022. Do we need to take another look at these vaccines? And also for those of us who live in polluted cities of India and are constantly sniffling and coughing and finding it sometimes difficult to breathe, how do we distinguish between flu, a common cold, asthma, air pollution triggered diseases, and the fateful COVID? COVID may no longer be dangerous, but long COVID still remains a matter of concern. The argument being that while you won't die from COVID any longer and you won't be hospitalized, you could still have an impact on your body that you still don't fully understand. To take us through some of these concerns, let's introduce our newsmaker on the program today. I want to welcome to the program Dr. Ishwar Gilada. Dr. Gilada is with us. Dr. Gilada, good to see you again. How concerned are you?
For having me on the show, Barkha. I'm really not concerned because of two things. Number one, JN.1 is not a new subvariant. It has been in prevalent already in 40 countries, and it is going on for last 7 months. In India, yes, it is new because India initially had only BA.2, and that BA.2 did not allow BA.4 and BA.5, and BA.2.86, which is called Pirola. There is a combination of variant from BA.4 and 5, and that was prevalent everywhere, but not in India. So for the first time, we see further descendant of Pirola, which is BA.2.86, and now it is renamed BA.2.86.1.1, and that is JN.1. What is JN.1 currently is a variant of interest. So initially, WHO names any new variant which is in whole genome sequencing found as a new. They call any kind of variant under surveillance or variants under study. Thereafter, if it start infecting people, then it is a variant of interest. But if it is not giving a oxygen demand, bed demand, ICU demand, ventilator demand, and people are not dying, it doesn't become variant of concern. So currently it is VOI, only variant of interest and not variant of concern. Secondly, whatever cases are we are seeing in Goa and Karnataka, Maharashtra, or couple of cases are they are seen in the rest of the country also. They are not producing any kind of morbidity and mortality. That means people are not landing up in hospital. 92% of the people with COVID, they are not even going to doctors. So patients have become smarter than doctors, smarter than medical community. And therefore, we need not worry at all. Number two, what we have learned from COVID is that we have overacted on COVID initially. Initially, we didn't know, but thereafter, we lost a lot of people due to collateral damage. Collateral damage is that you concentrate on one thing and neglect on other things. And those were like tuberculosis, HIV, lot of other infections, cardiac problem, immunization. Just to give you a simple example, we lost to tuberculosis in 2021, 5 lakh people put to tuberculosis. And to entire COVID, on record, we lost only 5 lakh people. So in 3 years to COVID, we lost 5 lakh. But because of COVID neglect, we neglected other things, COVID concentration or COVID mania, and we lost a lot of people to other diseases. And
Right.
we still to come at par with the regular immunization program for childhood immunization. And that is a major, major loss to us. So I think we should focus on COVID, but to a limited extent. When it is not variant of concern, it is not variant of discussion for common people. It is discussion only for scientific community or those which are doing research or genome sequencing and doing a vigilance and having a preparedness
So
drill.
in some ways, you're saying that the hyper focus on COVID was at the cost of other diseases, tuberculosis in particular, India missed our targets. But there is an argument put forth by some experts, Dr. Gilada, about long COVID, that even if COVID is no longer dangerous for you, even if it doesn't get hospitalized, it can impact your nervous system. There are talks about brain fog and so on, in ways that the scientific community still doesn't understand. And therefore, it's very important. There is a section of the scientific community that argues this, to not get infected. How do you respond to this?
See, COVID has problem with long COVID, prolonged COVID, but it is not in everybody. So if you look at many other diseases, they have a longer problem, but we have never studied. COVID has been over-studied or over-projected. So now, if currently the diagnostic dilemma is that a patient comes with cough or a common cold or a running nose, we do not know whether it's an influenza or RSV, respiratory syncytial virus, or COVID. And to do a test for this RSV or influenza is very expensive. It is minimum 5,500 rupees per test. How many people can afford that? And it is not required. So currently, a lot of cases are having influenza A or RSV more than COVID. Number two, if is a milder course, it is a upper respiratory tract infection, lower respiratory tract or lungs are not involved, then those people are not going to get long COVID. Long COVID was after Delta, where lower respiratory tract was involved. It was creating oxygen demand. People are getting into bed, and we do not know whether they were getting problem because of COVID, because of vaccine, or because of the drugs we use in COVID, which were some of them were thoroughly useless. So we need to study that, and that study is incomplete anywhere in the world, not only in India.
I think these are very important points. The overuse of steroids, ivermectin, so many antibiotics, all of this, dispersed in a kind of black hole of information when the pandemic was at its peak. What should somebody? You're basically saying, don't bother. Would it be correct to summarize your stand as being don't bother?
See, I would like to say one thing. There is a Kabir ka doha. दुख में सुमिरन सब करे, सुख में करे न कोई, जो सुख में सुमिरन करे तो दुख काय को होए. So every time COVID comes, any problem comes, then we think of immunity, then we think of exercise, yoga, etc. COVID has gone, people have forgotten. Even those people who were regular on walk and yoga and exercises, they stopped doing that. They got used to the work from home. I call work from home is a much bigger disease than any other disease. Today we get
yeah. That is the quote of the day. Work from home is a much bigger disease than any other disease.
Yeah, and it is financial disease, is a personal disease, is a social disease, is a family disease. Everywhere there are more quarrels because of work from home, and people have become so much sedentary that they are getting obesity, they are getting diabetes, they are getting hypertension, they are getting lethargy. कौन जाएगा यार उठ के सुबह सुबह walk? And this is the attitude people have developed. Again, COVID comes, we say, no, you develop your immunity. Your immunity should be all around the year. It should not be only for COVID specific period.
Well, I must say, I'm not a work from home fan, but there are many people who say that work from home is a very important and progressive development at the workspace for those who cannot afford the commute, for those who live far away. That for people like you and me, maybe we speak from a place of privilege. We've not had to worry about, at least today, we don't have to worry about these things. Maybe when we were young and starting out, it was costly even for us. So how do you respond to that?
You see, human beings are not meant to be confined in four walls. Human beings are confined to, meant to meet people, greet people, have some smile, go and enjoy the natural beauty, natural environment.
How do we do that when our cities are so polluted? How do we do that when our cities are so polluted? I think pollution is a bigger matter of concern than COVID.
I know, but what is happening, Barkha, that as a human being, for our survival, we have become so selfish that we are intruding every atmosphere of animal, of organism, of forest, of ecology. So everywhere we want to be, human being should be everywhere. Road should be there, over bridges should be there, under bridges should be there. But we are not bothered about, everybody has a right to survive, whether it's human being or any organism or any virus or bacteria or parasite or animal. So if we try to conquer everything, then we are going to face problem. And all these problems are coming because human beings have become so much ambitious that we want to conquer everything. We want to go on every North Pole, South Pole, buildings, building there. So I think that is not the way of life.
But so what you're saying is that COVID will remain an area of research for experts, for doctors, for scientific community. But for ordinary people who are not in this space, they should just carry on living with the best possible healthy lifestyle possible.
See, we categorize two kind of people. One, those which are below 60 without any comorbidity. One, those
Yeah.
which are above 60 and having comorbidity. Having comorbidity itself is a problem. Whether you are diabetic or uncontrolled hypertension, or you are having a cancer or on chemotherapy or on renal transplant or dialysis, these people, whether COVID or flu or any other infection, they will get any kind of those diseases because of their immunity. So COVID can get blamed in addition to is like a last straw on the camel's back. So we need to categorize these people, and even if everybody doesn't want to use mask, you should have a reverse masking, asking people which are above 60 and having comorbidity to use mask. So in a family of 5 or 10 people, if there are 10 people and nine are above below 60 and one is above 60, only one person is using mask. You are saving money of other 9 people. But if you are going out in rivalry, in group, or in some kind of social gathering, you are going to be conduit of picking up infection from one out of 1,000 people and bringing it to your home. Then you should use the mask. So you should categorize who should use the mask, and at the same time, our reaction should be proportionate to the problem. It should not be
Yeah.
disproportionate. Once you have a disproportionate, people will not follow any mandate. Now look at
Yeah.
example of Singapore. Singapore is a one fourth of population of Mumbai, and there are
Yeah.
66,000 cases. So that is 0.5% of the country's population, India's population, and thousand times more cases of us. So I think in that situation, what Singapore is doing, we should not try to emulate. We should make our own strategy, our own plan. We should not learn from others. We should learn from ourselves.
But here's my question about this variant. There is some research that suggests that it enters the lungs directly, that it could be pneumonia inducing. I just want you to clarify those concerns.
See, currently JN.1 is not giving any other specific symptom than any other flu-like virus. So ILI or SARI kind of virus. So in that situation, what you are getting is runny nose, little bit headache, some body ache, and upper respiratory tract symptom like cough. And within 3 to 4 days, it settle down. So if it settle down in 3 to 4 days, there is a saying that जो गुड़ से मरता है उसको जहर क्यों देते हो? So अपने आप से ठीक हो रहा है. You don't want them to run to hospital, get the test done. They already spent a lot overspent on those things. I don't propose any kind of common testing at all. You do a kind of a
What about
targeted
long
testing.
COVID? What about the concerns of long COVID?
But where is the study for long COVID? I have been telling for last 2.5 years. Published study of long COVID, whether long COVID is because of only COVID, or is it because of tocilizumab or some kind of steroid given, whether it is because of some other additional problems. So you need to study properly and then present. Okay, long COVID is in only delta or gamma or beta or alpha, which is not there. But it is sure that those who have got lower respiratory tract involvement, they are bound to have some problem. So whether you call long COVID or what you call a sequential problem of any sequelae of any disease, that happens. Somebody got tuberculosis, upper respiratory tract, which is a good immunity TB, but they got lower respiratory tract involvement, they will always have second time of chance of getting tuberculosis. So this has been taught to us since beginning. So what is involved? Whether only upper throat or pharynx is involved, or whether lungs are involved. And those people who already have some kind of allergies or allergic bronchitis or bronchial asthma or tuberculosis or COPD or smokers, I have not seen in n number of people who have left smoking because of COVID. I think smoking is a much bigger, another bigger problem than COVID. So if you are so worried about COVID, why don't you stop smoking?
Good point. I have to ask you in the end,
You have a lot of people
vaccines.
are smoking like chimney, and then they have COVID.
Yeah, I have to ask you in the end about long COVID, right? About long, I beg your
Yeah,
pardon, about vaccines, not about long COVID. Long COVID, we just spoke
yeah.
about vaccines. Now, the last time I had a COVID booster was when it was needed to travel. I don't remember when it was, maybe beginning of 2022, right? Now we are at the end of 2023. No, vaccines are available outside India, in countries like the United Kingdom. People are still getting booster shots. It's become like an annual vaccine. Would you propose an annual vaccine for COVID or not really?
See, at present, I will not propose any annual vaccine because at present, whatever COVID variants, subvariants are there, they are not lethal. They are not creating any kind of weight demand. The moment it comes, then we'll have a thought out annual vaccine, but annual vaccine should not be isolated COVID vaccine. It should be COVID, influenza, RSV vaccine combined. So you take one shot every year, that's fine. Secondly, most of the time, vaccine was not only for your own safety, it was for your travel, it was for some regulation, it was for you will lose your job, that kind of threat. So you decide what is it required. Currently, it is not required, number one. Number two, where is the vaccine in India? Vaccine which will cover JN.1 or BA.2.86, those vaccines are not there. So if at all you need a vaccine, you need to alert them. I really thank ICMR that they are immediately they supplied whatever variants are, sub-variants are there to the vaccine producing companies, particularly Covaxin company. So if they will do a research and they will keep it ready. But in that case also, the government will have to buy in advance some quantity of vaccine, then only they will start producing. Otherwise,
What
they will
would be
not
your
produce. They will they have already lost a lot of vaccine doses. So why they will produce when it is no market for them?
Now, I want to ask you, what would be your final word then? You believe that in a way there is over focus even today on COVID. People have given up healthier dimensions of their lives. Other diseases and attention that those diseases need have been compromised. And there is no basis right now to keep getting vaccinated because the variants will keep changing, the virus will keep mutating. So, last word, when you hear about 600 cases in 24 hours, 3,000 cases ho gaya India mein, you would say what?
See, our population is 143 crore, and in that 600 cases is nothing. Number one. Number two, there are two kind of population. One is general public. For general public, no worry. I don't want to be a spoil sport for the New Year rivalry, nor the subvariant of COVID which is available is just a spoil sport. Secondly, that community, which is a scientific community, medical community, government officers, they should do their own preparation drill, but that should be proportionate to the problem. For example, yesterday I had seen one clip coming from Karnataka. We reserved 6,000 ventilator, 3,000 this, so many beds. They are showing vacant beds. What will happen tomorrow if some patient comes? No, bed is not available. Why? The beds are designated for COVID. So that will you will be creating a collateral damage. So you create in a hospital of 1,000 bed, you say, okay, designate 25, 30 bed, fine, good enough. And you escalate as the requirement is there. You don't designate right now 6,000, 10,000 bed. It makes a good story to show how prepared we are, but it is not required.
Well, I think we needed somebody to de-escalate the concerns. And as always, you've done that, Dr. Gilada. Thank you so much for talking to us. I know your core area of research is HIV. And I think one of the things that you have flagged is how all of those other spaces need as much of media and public health attention as earlier. So thank you. And we'll talk to you again soon. Take care.
Thank you. Thank you. Happy New Year.
Bye, sir. Happy New Year. Mojo Story has always made a commitment to its viewers to go to where the story is. And as you can see here, we are at the epicenter of the Israel war on Gaza. We are right at the front line, about 1 mile from the Gaza Strip, as the Israeli military gets ready with its tanks and its gunners to begin its final frontal assault that will take troops into Gaza. As we said, we are not like other organizations. We believe in giving you all sides of the story objectively and as much as possible from the ground. And that's exactly what we're doing here, covering the biggest global story today from the epicenter of the war zone. So please, we need your support. Support us, become a Mojo member, subscribe to us, spread the word, and thank you for your support.